Okay, we continue our discussion on circumcision, and we welcome in our studio in Johannesburg two special guests, Dr. Sifas Chikanda, who is a Senior Program Manager at Anova Health Institute, and Dr. Kolile Zamini, an MMC Medical Officer for the Oram Institute. And ladies and gentlemen, welcome to Health. You obviously heard the problems that we unpacked in the previous segments. Let us try and see what possible solutions we can have for this. Maybe let me start with you, Dr. Chikanda. We know that the MMC, or male medical circumcision, was basically advocated as a prevention strategy against HIV. But clearly, there's a problem with the traditional circumcision in that, for obvious reasons, we mentioned the deaths, the infections, and so on. Now, maybe let me ask you to give us a broad perspective in terms of the objective of the MMC, the targets, and what sort of areas you're looking at, getting things off.
Right. Thank you for the opportunity. So, if you look into one of the things that's said in the public space is that MMC was advocated as a prevention strategy. Right. That's very accurate, but what we're talking of is what we call combination prevention. Yeah. That it's only effective if it's combined with other prevention strategies that are already in place. Right. Your strategies like condom use, abstinence, reducing the number of partners and the like. Yeah. So one of the ways that MMC intends to work is that if you're going to circumcise a certain percentage of the population, then you get a protective effect over the population, and that has to be done within a specific time. Right. So if you look in South Africa, at the end of April, we estimate that they circumcised about 1.3 million men since starting in 2010. Yeah. And the hope is to go to about 4.8 million by 2016. Right. Hopefully that if we can get that 80% coverage, then it becomes more effective. Yeah. Because the less numbers you do, then the effect of what we call the herd immunity is less. Yeah. So the intention is to get a certain cohort covered.
But was there any consideration or was there any influence from the problems around the traditional circumcision procedure when the MMC was introduced?
So when MMC was introduced, what was very clear is that partial circumcision is not as protective as full circumcision. Mm-hmm. Right? So you've got challenges. The first challenge being that do we always get full circumcision when we get to traditional circumcision? And there was a study done in the early years whereby 41% of the men that said they being circumcised traditional were found to be partially circumcised. Mm-hmm. And there are some cultures where it's not the full circumcision, but it's just a partial circumcision that's considered circumcision. So from a scientific standpoint, what we want is to actually get full circumcision because that's where the basis of protectiveness is found.
Okay. Maybe at this stage, let me invite Dr. Zamini to, because Dr. Zamini, you hands-on, you right there, you actually conduct these procedures in your rooms. Can you tell us about your experiences with conducting these procedures in the Eastern countries?
Yes.
Yes, right. Can you tell us about your experiences with the procedure itself?
There's quite a lot of men that come, they with all the education that's going around, they come voluntarily to ask for the procedures. Right. You get quite a lot of them coming in that have been circumcised traditionally and wanting to be circumcised again because they feel it's not properly done. Right. So with that, and they say it's safer with the doctors, so they wouldn't want to go back to the mountains. Mm-hmm. They come to the doctors for the fact that it's painless, except for the injection part, and there's less complications there. Everything goes well usually.
So maybe just before that, what sort of training did you have to go through to be able to conduct this? Did you have any extra training just apart from your medical doctor training?
Yeah. Yes, besides the basic degree, you go specifically to CHAPS, which is in Orange Farm, an NGO that started the whole MMC program. Yeah. You spend a week there. One day is what oral, like oral
Lectures.
yes.
Yeah.
And then the rest of the week is practicals where you get the senior officers monitoring what you're doing before they issue the certificate.
Okay. So what sort of age group do you normally circumcise in this program?
In my rooms, I take anything from 2 to 16,
Okay.
but in government, in the public sector, it's at least 10.
Okay. But do you get, maybe now linking it to traditional circumcision, do you get a lot of people coming to you to say, would rather come to you than go to the mountain? Is that, and can you perhaps give us an idea of that, these figures? Is it something that is happening more and more, or is it a minuscule amount?
I'd say it's happening more and more these days because of the education that's going on.
Yeah.
Definitely this year I've seen quite a few compared to last year.
Yeah.
It's more than last year this year.
Right.
And they will come this side and say, please circumcise me. Next week I'm going up to the mountain.
Okay.
You'll say, so we'll do the procedure, make sure there's no complication, they're healing, and then they will go.
Okay. Dr. Chikana, can you perhaps just give us a regional perspective of this problem? I mean, you've experienced, working around the SADC countries and so on. And the problems of traditional circumcision that we spoke about earlier, especially in the Eastern Cape, is it something of a regional sort of problem, or is it just peculiar to the Eastern Cape?
Not necessarily peculiar to Eastern Cape. I think in South Africa the problem tends to be, the focus tends to be on Eastern Cape because of the population dynamics and the numbers that we're talking of, that we say the Eastern Cape population is almost about 20% of the national population.
Mm.
Yet you still find in the Beles in KwaZulu, they also practice it, the Bedis. But if you look into a regional perspective, you find that the controversy has not been around more traditional versus medical. It's been around the science behind it, that is it really acceptable. And you still find there are some scientists that still don't buy into the concept of medical circumcision.
Yeah, I'm just looking at the map here. The countries that participate in this go as far up as Ethiopia. So it is something that is practiced, on a wide sort of basis, isn't it so?
True.
So are you seeing medical male circumcision ultimately replacing the circumcision aspect of the initiation process?
I think all trends are pointing to that effect. You see in countries like Malawi that had a very strong traditional component,
right,
that there's a drive towards medical circumcision.
Okay.
And understand where this is coming from. We sort of, in most of the countries, there's more access to information, your social networks, and through that, information is filtering down to the ground. So you find if I'm a parent and I'm a teacher, and I've heard the statistics of what happens in traditional circumcision, I'm positioned to decide between the safety of my child versus holding on to tradition.
Okay.
So there is quite that move towards medical circumcision.
Yeah. I mean, obviously sensitive to the idea that you want to, preserve the tradition in general, but just want to focus on making the circumcision aspect safer. Well, unfortunately, we're going to have to leave it there, and I want to thank you very much for your contribution. There was Dr. Chikanda from the Anova Health Institute and Dr. Xolile Dlamini, an MMC practitioner for the Oral Institute.